the recommendation was made that along with the standard panel that performers start adding, swabs to their testing panel, oral, that kind of. Is that, and some people didn't know if that was a little too much. I mean, should that really necessary? What's your take on that?
My take is that's absolutely necessary. Knowing, the experience I have in the field of sexual health for all, 20 years. And when I joined the board of directors of PASS a couple years back, that was one of the first things that stood out to me that was kind of really lacking in the panel. And I know, the leadership at PASS had kind of always, had been knowing that needed to be included. So in the general population, aside from like LGBT population or sex workers, adult industry, about 30% of gonorrhea and chlamydia is what we call extragenital, or in the throat or rectum, not in the urogenital tract. In our population at the LGBT Center, about 50% of our positive gonorrhea and chlamydia cases are extragenital. And so you would think probably the adult industry is somewhere in between, or maybe on the kind of higher end of that range. So doing a urine only test, we're missing a really good percentage. Yeah.
Well, what I think what surprises me about all this is why did it take this long to start recommending they get those oral and
I know sometimes it takes these, these kind of situations, these clusters and outbreaks to, bring about change.
Yeah,
absolutely agree.
Because you go pee in a cup and you test negative, that doesn't mean it just means you have it down there. You could have it in your mouth, have it in other spots. So I guess, depending on the type of scenes you're shooting, and most people are doing all sorts of oral scenes. I mean, I guess it is important for them to be testing all the time.
Yeah, and we have patients and performers that'll say, well, I don't do receptive anal, but sometimes things are, fluids and things are all in the general proximity. So it is possible to, and I think another point to that kind of misinformation that I heard a lot of folks thought if they do the urine test, that's going to tell them if they have gonorrhea or chlamydia anywhere. And it really is it's really site specific. So you have to test each possible site. The other piece, some folks thought if they have it in their throat or in the rectum, that it will transfer to these other sites, which is not true unless you are physically, transferring it. So
stay there.
Yeah, those tests are so important to do to help keep the community safe.
That's interesting you say. There was a male performer in the industry, very well known, very good performer, who is straight and, like you said, is not receptive anal, but did test positive, there, and it could just been some fluid dripping down there, or
absolutely
whatever. So
yeah, and those things are a bit less common than direct contact, but they certainly can happen for sure.